I've been reflecting on the COVID pandemic that's been afflicting the world for about the last year or so. And I was kind of thinking about the unique challenges that have kind of come with the pandemic and perhaps could be insightful for those of you that don't work in hospitals. And one thing that I think has been a unique issue or problem that's kind of come with the last year is the emotional drain that has come with either directly or indirectly interacting with or working with patients who are there for COVID treatment. I'm in the float pool. I'm a nurse, in case you don't know, and because of that, I work on a lot of different units, and I've worked on many units that have cared for COVID patients at differing levels of acuity. And one thing that I see a lot in terms of emotional drain is how the COVID's been kind of impacting staffing in hospitals. Because one thing that comes with this pandemic is you get employees, you get healthcare workers that kind of get sick and have to quarantine for a bit, and then so the amount of healthcare workers available to work in the hospital goes down, which often can increase the workload for the people that do show up to work because they're healthy too. And kind of the uncertainty of knowing the workload that you'll be getting or that you'll be walking into because of people being sick and the workforce shrinking in the hospital is something that does contribute stress or uncertainty or maybe some anxiety for people. Another thing that I feel has been contributing to emotional drain as a result of the pandemic is the uncertainty of patient outcomes after providing interventions. At least in the hospital that I work at, a lot of COVID patients kind of have a similar order set when they're admitted, so a lot of them kind of get similar treatments depending on the progression of the disease in their body. A lot of them get steroids and convalescent plasma if they don't already have the antibodies for the coronavirus. A lot of them get remdesivir if they qualify for it, and they get respiratory support, whether in the form of nasal cannula or face masks or BiPAPs or high flows or whatever it may be. And so we give and we provide these interventions, these various medications and respiratory and devices that help support the respiratory system. And then at that point, it's kind of like on the body to see how it responds to the interventions. Will it respond favorably and they will recover, or will it not respond as favorably and their condition just kind of deteriorates? And there's an uncertainty about that because some people respond well, other people don't. Many people that kind of get admitted to the hospital are there for multiple weeks. And another thing that I think kind of going along with that prior point is that's been contributing to emotional drain is the death that kind of comes with a lot of these patients passing away, either on the units that you work on with you while you're caring for them, or maybe getting transferred to another unit and passing there, or maybe you see them getting sicker and you feel like they're probably gonna pass somewhere else. So definitely there's been a lot of death on these different COVID units, and that's also been a drain on the workforce as well. So if you work with people that or know people that work in hospitals, might be a reason why they're probably a bit more emotionally drained than they have been in times past in the lieu of all this pandemic stuff.